Hi, I'm Scott Bryant with US Bioservices. I'm the Senior Director of Business Development for Rare and Orphan Disease. I just took part in a ECRM meeting. We had some thought interaction pods. Our topic was commercialization of rare and orphan disease. And there were really 5 topics that seemed to keep coming up in the different conversations that we had. And the first one was payers are probably the most important. So you really need to understand what the payer mix looks like, the patient population, and how you're going to be able to get patients on therapy most quickly. So the second thing that came up is that you really need to think locally about these patients and understand what the patient's going to be working with in their area. A lot of these clinical trials in rare and orphan are done overseas. Sometimes there's multiple different nations and countries that are involved. And smaller companies that are bringing these drugs to market really need to think about what's going to happen here in the United States or even in some certain individual geographic areas based on the different product that the patient will be taking. Okay, so the patient journey is probably the most important piece of the entire puzzle, and you really need to understand what's that patient going to go through, right? The patient ultimately is going to be working with providers, they're going to be working with the pharmacy, they may be working with hospitals, they may be working with caregivers, right? Certainly in rare and orphan, a lot of times there's parents that are involved in that. So you really have to try to understand what the patient journey is going to look like. What you need to do is pick the right partners. So if you're going to be going with a 3PL, how do you want to do that? Do you need specialty distribution? Is this actually a specialty pharmacy product? And if it is, do you go with people that have a significant amount of experience in that disease state or that topic, or do you go with somebody who's small because it's just a very, very regional kind of niche patient population? And lastly, I think the thing that came to the forefront from our conversation is that you need to ask for help. We had several pharma companies that were there that thought they understood what was happening with their product, but because of the robust conversation that we had and the good mix of different folks that we had there, from people from 3PLs and from specialty pharmacies, etc., they actually raised a lot of questions that helped some of our pharma partners understand that it's probably okay to ask for help, make sure that they get the right plan in place early and often, especially for these rare and orphan diseases. A lot of times these patients have not had any hope at all, and the last thing you want to do is inhibit their ability to get the product as quickly as possible.